Hi, my name's Karen. I'm one of the midwives at my Expert Midwife, and this week I want to talk to you a little bit about water birth. One of my favourite subjects. I've seen lots and lots of water births since qualifying as a midwife, and water birth is basically about being in a pool during your labour, and often your birth and afterwards as well. And you think, well, why would I want to do that? Well, water has wonderful properties where it's really relaxing, calming, and can help with pain relief during your labour. So what sort of pools are available for you? Well, usually in the hospital it will be like a really large bath, sort of a rigid sort of plastic bath, and they can come in all different shapes and sizes. If you were to use a pool at home, or sometimes even in some of the birth centres or hospitals, they have inflatable pools which have just one-use liners that go in and out of them. So obviously the inflatable ones can be a little bit more comfier on your knees, but water has the ability to make you quite buoyant, and so you can move around a lot more easily, and you can really adapt your pool to suit yourself and get into the positions that you want to get into. Lots of women would spend a lot of time leaning forwards and over the side of the pool because that's how they feel the most comfortable. Your midwife will be checking the temperature of the pool, and that will be about 37.5 or under. During your labour it can be anything you want it to be under that temperature, to suit your comfort really. But during the birth, as your baby comes out, your baby's coming from your body, which is around 37 degrees centigrade, and going into the pool temperature, which you want to be the same, so it's a smooth transition for baby. Babies that are born into water, they're often much calmer. They come up gently up to the surface. Either you, your partner, or the midwife can lift your baby up to the surface, and they normally just have a little bit of a look around, and they seem really quite calm because I think of that gentle transition. So if you want to go into the pool and use the water for pain relief in labour, you think, well, what other things, are unique to water birth? Well, women often report that they feel like a sense of privacy, that they feel secure within this pool, that nobody can kind of get to them, and they feel like they're sort of connected with themselves and their labour, and have the ability then to be able to sort of disconnect, get on with their labour, and to zone out of the other things that are going on. So basically they report better birth satisfaction and the ability to be able to focus a bit more during labour. Often a question is asked that what if my baby starts to breathe under the water? Well, the natural physiology for your baby is to not do that. So your baby comes out when it's born and it's already got fluid in its lungs from when it's been inside of the womb. So it has to clear that out anyway. So when it takes its first breath, it doesn't do that until it hits the air and comes out of the water. So don't worry about that. There are no recorded cases of babies, of that happening to babies, under the water. Also, the research that is available surrounding water birth reports that it can actually make the first stage of your labour, which is the bit from where you're in active labour, so regular contractions, to when you're fully dilated, shorter, and then the second stage of labour, which is classed as from when you're fully dilated to the pushing your baby out, that's shorter as well. So that's got to be a bonus. Some hospitals, if you go in, won't want you to get into the pool until you're in active labour, because it can slow labour down a little bit. But if you are contracting regularly I've often noticed that equally it can I'd say 50-50 really, it can actually speed your labour up. So make sure that you can get in the pool when you're regularly contracting, rather than a measure of how dilated you are, for instance. If you're at home, then obviously, and having a home birth, then you can get in and out of the pool and use it throughout your labour, because you'll just be in your own home, and you can do what you want there. You might be thinking of other forms of pain relief and thinking, oh, what if I need something else? Well, you can use the gas and air in the pool as well, so that's a bonus too. So like I say, women are often leaning over the side of the pool with their bump all into the water, because that's often what's the most soothing way to get the most of the pain relief. So you'll have your gas and air sort of over the side of the pool, and you can get into quite a good rhythm with that as well. There might be a time when your midwife wants to recommend that perhaps you need to get out of the pool. So just be aware that there could be concerns about you or your baby, and that could be something to do with when they're listening. They've got a waterproof Doppler to listen in with. That there might be concerns about your baby's heart rate, or perhaps your temperature has gone up a little bit, because sometimes in this weather, when it's a bit hotter, or you're in a hot hospital room, and warm water in a room can heat the room up anyway, then what can happen is your temperature can rise a little bit. So your midwife might just want you to get out and cool off a little bit before getting back in. And obviously, if your waters go and there's the baby's had a poo in the waters, which is meconium stained lycra, then you'll be recommended to leave the pool then for extra monitoring for your baby. So just listen to your midwife, and bear in mind what she's saying, and if it's recommended to get out the pool, you might want to have a think about that, even if it's just a temporary thing. There's also been a few concerns that we've noticed about hospitals not offering water births to women at the moment during the COVID-19 pandemic. We've noticed now that seems to be on the up again, and that you probably find that about 3/4 of hospitals have now reinstated water births. It was just about the uncertainty of the virus surrounding how it could be transmitted and things. So hopefully your hospital is offering those if you don't have any symptoms of the virus. So I hope you've learnt a little bit from this video, and see you again for another one.